Lumbar spondylolysis is a condition in the lower back where there is a defect or fracture in the part of the vertebra known as the pars interarticularis. The pars interarticularis, also known as the isthmus, is a segment of bone that connects the facet joints at the back of the spine. It is a small, thin part of the lamina that has a poor blood supply, which makes it susceptible to stress fractures. Fractures of the pars interarticularis, known as spondylolysis, usually occur at the L5-S1 level and rarely at L4, L5 or higher. They can occur on one side of the vertebra or on both. Spondylolysis usually occurs in children between the ages of 5 and 7. It is sometimes called the gymnastics fracture because it is associated with sports that require a lot of bending backward. It is thought that repetitive stress on the spine has a cumulative effect that causes the pars interarticularis to break. Spondylolysis sometimes causes spondylolisthesis, which is when one vertebra slips forward on the vertebra below it. Symptoms include a deep ache in the lower back, pain that is worse with movement, and tightness in the hamstrings. If the vertebral slippage is severe, nerve roots can be compressed. However, most people do not experience symptoms from lumbar spondylolysis at all, and those who do tend to develop problems in adulthood or in adolescence.
Of lumbar spondylosis caused by an intervertebral disc herniation is made worse by prolonged periods of bending forward while sitting. Back pain in lumbar spondylosis caused by facet joint osteoarthritis is worse when standing and is relieved by sitting or bending forward. Pain in the legs may be a symptom of lumbar spondylosis. It occurs due to compression of nerves, which extend into the legs through the lumbar portion of spine. Besides pain, lumbar spondylosis can cause weakness, numbness, and cramping in the buttocks, legs, or feet. These conditions arise due to nerve compression, too. In severe cases, lumbar spondylosis can cause compression of the spinal cord and the development of lumbar myelopathy. This condition can cause problems with coordination and balance. Lumbar spondylosis is a degenerative condition of the lumbar region of the spine. This pathological condition can include disc herniation, facet joint osteoarthritis, and bone spurs. The spine is made up of 33 individual bones called vertebrae. These are separated by intervertebral discs. A typical lumbar vertebra consists of a body and a vertebral arch, which has several processes for articular and muscular attachments. Facet joints are located between each pair of vertebrae. They guide and limit the movement of the spine, providing stability and bearing a share of the load on the spine. Each spinal disc has a tough outer shell called the annulus. The center portion of the disc, the nucleus, contains a gel-like substance.